So we have no further active cases in Queensland of COVID-19, meaning we have 16 active cases. 2 are being managed by the Gold Coast, 2 in Townsville, 1 in West Moreton and 1 in Metro North. 4 of them are in hospital, none are receiving intensive care. In the last testing period, we did 9,122 tests, which is a good increase and is what we would want to see under the circumstances. 56 of those tests relate to the Brisbane Youth Detention Centre and have returned negative results. There are still, of course, outstanding tests that were of the 75 that were taken yesterday. The rest of the young people there, the 127, will be tested, as well as staff. The Chief Health Officer will also outline an historic case that has been identified in this testing period and will be added to our probable cases count, and it relates to a known historic cluster.
So no new cases overnight, which is excellent, particularly all the work that was done yesterday at the Brisbane Youth Detention Centre, where 56 results have already come back and all of those have been negative. And of course, the vast majority of those were done on the children, the youth in the centre, so that is a good outcome. We'll continue to test all of the youth in that centre, plus all of the staff, and continue that process over the weekend. Now, we did have 1 new case overnight, a probable historic case, so these are one of those ones that are being picked up on serology. It's of no concern, and we can actually link it back to a known outbreak that occurred earlier on in the pandemic. So that just lets us know that we had more cases at that time when we had that large numbers, when we were getting those 80 or so cases every day, which is good that we're continuing to get that information come through. It's really, really important that people continue to come forward to be tested if they have any symptoms at all. Any symptoms, no matter how mild. That is vitally important, and that you isolate yourself until you get the result of the test. Then we also must maintain social distancing. If anything, this last week has shown to us that we don't know when we might get the next case, and the best way to manage that is to manage social distancing. And we can see that in the Brisbane Youth Centre that they did have policies in place, and we'll see what the result of that is after having had a case in the centre. Hopefully with all of the policies, they were very rigorous policies, we won't get spread there. And we need to have that occur through every aspect of our lives. It's difficult, it's annoying, we all want to go back to normal. We can't yet until we've got this pandemic under control and we have an outcome with either a good effective treatment or a vaccine.
Dr. Young, has there been any connection established between the 2 girls who came back from Melbourne and anyone inside the detention centre?
Not that I'm aware of. At the moment I'm waiting for the genomic sequencing of the virus that the lady has who worked in the centre and those young women who went down to Melbourne. I haven't got that genomic sequencing yet. I expect it in the next week.
So it might take a week before we know if there's some sort of link there. With the woman, has she been tested again? Like, how confident are you that this is an actual positive and not a false positive, for example?
I'm very, very confident. I must admit, when I got the first result the other night, I did question it because there were no links. So I asked for a second test to be done immediately, which was done, and it was definitely positive. So I'm absolutely, totally confident this is an actual test. Now, we will get the genomic sequencing, so that'll give us even more information.
With all the talk, Alison, today and the last couple of days about the borders, can you give us some idea of what the medical health advice is about the border?
The health advice is that we must, and I say this every single day, we must minimise movement of people in and out of areas that have got higher numbers of cases. So here in Queensland, you heard, we've got 6 active cases. So that means we need to protect that. And the best way of protecting it is for people to not go to places where there are active cases and bring it back into Queensland. So that's the whole border arrangement. Now, we do have some exemptions for that. We can't be as strong with our domestic borders as we are with our international borders, because we are one country and there is a lot of movement. So that's why we're allowing people who work in the construction industry, the resources and mining and the agricultural industry to continue to move over the border. There are limits, of course, there are requirements, so we need to manage those, but ultimately, in my view, if we were to have an outbreak in a construction site or a fruit picking site or in the resources sector, we could manage that by closing that area down, and all of those industries know that. So that's why they're putting in place their risk management in their areas. So, but that's really important we keep that movement going, although it is of course a risk, but it's less of a risk. There are other people I'm far more concerned about, which is why I'm being very rigorous about those. I don't want healthcare workers crossing the border, because they're coming from high-risk areas, working in high-risk situations, and then coming into Queensland and going into a high-risk situation, either an aged care facility or a hospital. So we've made decisions there that those have to be managed. Similarly, police. I don't want police crossing the border one side on the other, because they're in high-risk situations. They're managing borders, they're managing hotels, they're managing out in the community. So again, I've got concerns there. And then I don't want people crossing the border who can actually manage their lives where they are. So I don't want them coming across to as tourists for recreational purposes or to go shopping. They can do that on their side of the border. So it's all about risk managing. I'm concerned about the amount of movement out of Sydney into northern New South Wales. That definitely concerns me. It is good to see that New South Wales is looking at their risks in Tweed, because I know that were the virus to get out into the Tweed area, that would be a very big concern for us in Queensland.
I missed on that. Qantas has revealed that its second most popular flight is that Sydney to Ballina. How much of a concern is that to you, given the movement in New South Wales?
Exactly. That's the reason behind why we've done all this and why I'm keeping such a close eye on what's happening in Tweed, because I'm well aware of that movement. There is no restriction in New South Wales for people to move into northern New South Wales, so it is a big concern.
So how would you describe the current situation in New South Wales and Sydney at the moment?
It's clear that they're getting on top of it. The numbers are coming down, which is really reassuring, but they're still having those cases that they don't know where they came from. So that is a concern, and it means that there is still a risk, and indeed we've seen it here in Queensland with people coming out of Sydney, coming into Queensland. So I am very concerned about people coming out of Sydney, coming into northern New South Wales.
Would your advice to the Premier today before National Cabinet be no change to borders?
That's my advice today, yes.
Dr Young, Peter Dutton said this morning that our border closures are driven by politics. What do you say to that?
Well, my advice is driven by health, and that's the only issue that I consider.
And he also said if we've got premiers who are pursuing an elimination process, the country will go broke. Is Queensland pursuing an elimination process?
No, if we were pursuing an elimination process, I wouldn't be recommending that all of these workers cross our border, who definitely are at risk of bringing the virus in. But I believe, because of our great systems in place, we can manage any case in those selected areas very quickly. But if we wanted an elimination strategy, our border would be closed to everyone.
Minister, can I get your...
Oh, sorry, can I just
Yeah,
ask a
sure,
general
sorry.
question? At Wacol, we've been contacted by direct family members of people who work at the detention centre who say that some of the people who work there have been told that they're only going to get tested if they've got symptoms or if they've worked directly with this woman. Can you shed some light on who's getting tested, when are they getting tested? Like, is it a possibility that people just haven't been told that they need to get tested yet, or...?
Every single resident in the centre will be tested. Most of them have already been tested. We're waiting on results. every single staff member who's worked in there during the period of concern will be tested, and any residents who have left the centre during that period, because there's quite a high turnover in that centre, we're tracking down and we're testing. So we tested one last night who'd been in the centre recently, and that test was negative.
And is it a possibility that some of the staff that work there, for example, they haven't been tested yet, but they will be tested?
Oh, absolutely. There's a lot of staff, well over 500, who work there, and not all of those, of course, were on duty yesterday or today even. So they'll just methodically go through and organise to test all of those staff.
Right.
Dr. Young, we were talking about the borders before. We've still got a lot of complicated medical scenarios. For instance, we've heard from a mum who had a baby in Grafton. It was an emergency C-section. The baby was taken to the Gold Coast for treatment. The baby's now stronger, but Queensland Health will only return the baby as far as Tweed, and somehow mum has to meet the baby there.
That's often what we do. We have an arrangement between the ambulance services in Queensland and New South Wales, so I don't think that's any different to the normal process. But that's a question that we can always check with ambulance. But genuinely, that is usually what happens. We will move someone to the border because New South Wales has got a very, very competent ambulance service, of course they do, and just hand over.
But the family, I guess, feels a bit like the baby's just being dumped there.
No, of course not. No. New South Wales has got excellent health services. I mean, we have excellent health services, but New South Wales does as well. I have no concerns
And
there.
you touched on the exemption process the other day. You obviously have a lot coming across your desk. Is there
Yep.
any update on that, on how that process may be?
Yes, so every time there's a change to the border direction, we have to change the exemption process. So we're just working that through now. So the most recent change was 1 a.m. Thursday morning, so we're just working through the change to the exemption process. But we have gone and clarified all of the medical exemptions.
Dr. Young, sorry this has been on this already. Do we know where this woman has been in recent weeks, the woman who was infected with the virus?
Yes, so we're working with her and we're getting that information at the moment from her. But essentially, she's really been mainly at home and at work, but we're just working through where else she might have been, and we'll put out a public health alert if we get any additional information.
Minister, can I get your reaction to those comments by Peter Dutton today that it's all about politics?
Oh, look, I don't take too much notice of what Peter Dutton says, but I'd just note that he is one of the few people to have actually personally brought COVID-19 into Queensland. He knows personally how terrible this disease is. He should know better than anyone how important it is that we keep the virus out of our state. We will continue doing our job, which is keeping Queenslanders safe. Peter Dutton has one job, and that's keeping our borders safe. And he has consistently failed. He's failed on cruise ships, he's failed on hotel quarantine. Peter Dutton and I represent the same parts of the world. And if he wants to, I'll challenge him. He and I can go for a walk in the shops at Strathpine or Kalanga, the neighbourhoods we represent, and see what Queenslanders think. Queenslanders want our borders to be kept safe. They want Queensland to be kept safe for Queenslanders. They want their government to continue to take the health advice.
Is it possible, do you think, to have a national approach on borders? Because we know that the border decisions at the moment are made by states. Is it feasible to have a national approach on it, given cases happen in different areas?
Look, I think that would be challenging. I know that the Premier will put very forcefully Queensland's case at the National Cabinet today, which is that it is the right of Queensland and of Queenslanders to keep our state safe. Throughout this pandemic, the states and territories have had different experiences at different times, and so it's important that they have the flexibility to put in place measures that keep their populations safe. And we will continue to do that, just as the governments of WA, South Australia, Tasmania continue to do so. I note that Peter Dutton doesn't do morning TV attacking them, though. He spends his time attacking the Queensland government, who, after all, are spending their time keeping him and other Queenslanders safe.
Thank you.
Very good.
Can I ask you just a quick question, please?
Oh, we totally wrapped up, Jack.
Come on, Jack.
On camera.
It better be good.
So just on
Secure
camera,
him up.
Milner, the column in today's paper, he says,
Yeah, see, that's a disappointing question.
yeah,
You could have done better than that.
he's saying the lack of electoral complacency and hubris is palpable in Labor circles. How would you respond?
Oh, look, I think people would understand that I'm not spending too much time focused on the election. My days, every day, are focused on COVID-19 and Queensland's health response, as well as ensuring our hospitals are taking are taking care of Queenslanders in every way. So I reject completely not just his claims about culture within the party, but also his claims about our economic planning. You know, it was only yesterday that the Premier spoke at the Centre for Economic Development. At that luncheon, she launched the next stage of our economic recovery plan, which I think demonstrates that we are 100% focused on the jobs and the health of Queenslanders.
Sorry, Minister, I want to just ask one more question.
Another one?
Yesterday, yeah, well... now
Jack
that
got
you've
the sneaky
now that
one.
Now that you've brought up the plan...
Yes.
Yesterday, the Premier said that the only reason that Queensland's economy can be open is because the borders are closed. Is that not taking it into a political sphere? Is that not politicising the issue?
No, I think it's about clarifying that our health response is a key part of the economic response. You know, there's no jobs growth in Melbourne right now, whereas we have people here back in work, and that is because we've been successful at suppressing COVID-19, successful at keeping it out of our state. And so there is no choice between a health response and an economic response. The first stage of any economic response has to be the health response. The first stage of getting businesses open and back to work was and continues to be the health response. They are inseparable.
Just on the detention centre
Go
again, are staffing levels there at the
I blame you, Jack.
Staffing levels at the moment at the detention centre, how's that being managed, given you've got so many being tested, and have you brought in like a relief team, or how's that?
Yeah, the Youth Justice Department have very advanced pandemic plans that were developed with us before this and are now being put in place. They are not taking new young people into the centre. There may need to be the quarantining of some staff, but they will be able to manage that within their staffing, I understand.
Oh, sorry, I actually just have one more for Dr.
I'm really sorry.
Oh.
Do you know who the State's Coordinator General is?
Tony is doing a great job as our Coordinator General. She definitely is.
Sorry, if I can just ask you one quick more question. Sorry, Shane, these are important health issues, as the Deputy Premier just pointed out. Yesterday, there was discussion about this woman and her symptoms. Can you clarify, was she symptomatic? What sort of symptoms was she showing?
Yes, she had symptoms, and they started on the 10th.
What sort of symptoms? Were they
Very, very mild symptoms. Yes.
Thank you.
That is why now I get to have...
Oh,
Yeah,
shut you down.
long answer.
That is why, no matter how mild your symptoms are, or indeed, as I often say, if you're not sure if you've got symptoms, so you've got something and you're not sure, get yourself tested. That is the best way to keep yourself, your family and the community safe. And a lot of people are doing that, because I can assure you the 10,000 Queenslanders who we're seeing most days get tested, not all of them have got those traditional symptoms. They're coming forward, they're getting themselves tested. So it's really important. Any symptoms at all, or fever, or history of fever, get yourself tested. It does mean you'll have to stay in home isolation till you get the result, but that is a really important thing to do.
Beautiful.
Thank you.
Very good.